This is the procedure for doing a transfer set change that requires capping off. A patient may need to be capped off if their PD catheter is no longer needed, for example, a post-kidney transplant patient. Patients still require weekly flushing and routine exit site care until their OR date to prevent risk of erosion of their dormant catheters. Note, this process is only done if it is certain that an OR date is pending within a month for a PD catheter removal. These are the supplies needed for this procedure. A 5 cc syringe with 5 cc's of heparin using the heparin 1000 units per ml, a small white catheter clamp, a locking cap, sterile dressing tray, sterile gloves, 2 packages of 4x4 gauze, 2% chlorhexidine solution, 2 masks, one for yourself and one for your patient, and clean gloves. Please keep in mind that this is a sterile procedure and proper hand washing is required. An MD order must be obtained before starting this procedure. Before setting up your sterile field, make a quick check. Add a clamp. Do not disconnect. Just loosen and retighten before starting your procedures. If a PD catheter is to be dormant for more than 24 hours, it should be locked with heparin to ensure patency. Start by taking 5 cc syringe, draw up heparin using the 1000 units per ml, take your 5 cc syringe with heparin, start by unlocking the transfer set and flush the PD catheter. Start by preparing your sterile dressing tray. Ensure that your gauze, 2% chlorhexidine, your white catheter clamp, and your locking clamp is all on your dressing tray. Open your sterile gloves using the wrapper as its own sterile field. Ensure that the patient is donned with a mask. Start by taking your chlorhexidine soaked gauze, open it up lengthwise, and ensure that your gauze is not soggy. Using a 2x2 sterile gauze, hold your catheter and lift it away from the skin. Place the chlorhexidine soaked gauze from the connection point to the titanium adapter. Leave the gauze on for at least 1.5 minutes. Then repeat again with a new piece of chlorhexidine. To discard it, you'll shimmy the chlorhexidine soaked gauze to the exit site point. Ensure that this process is done for a total of 3 minutes. Next, you'll take a dry gauze and wipe the catheter clean. Next, you'll take your white catheter clamp and secure it below the titanium connection. Note, a sterile gauze was used for this procedure. Taking another dry gauze, you remove the transfer set, then discard the tubing. Soak the titanium catheter for at least 3 minutes. You may use your sterile dressing tray and place it in the chlorhexidine solution. Next, you will dry very well and ensure that the excess chlorhexidine is removed. You can ensure that the chlorhexidine is removed from the internal aspect of the catheter by tapping the catheter into the gauze. Then you'll take your locking cap and attach it to the titanium. Perform routine exit site dressing change as a clean procedure and place shortened cap line under the dressing.